Hello everyone. Let's see about lymphatic system. So what is lymphatic system? What's its main role? What it's give? How its works? So let's see. Okay. So it is a defense system and fluid balance system. It gives immunity and works as drainage system. So these are the basic. Okay. Now we see about the lymphatic and immune system at a glance. So the functions of the lymphatic system. Network of vessels that picks up excess tissue fluid, cleanses it and returns it to the circulatory system. Next, picks up fats absorbed by digestive system. So the another function of the immune system is fights disease and infections. Okay, let's see about anatomy and physiology of lymphatic system. First, remove excess tissue fluid. Collect excess tissue fluid throughout the body. And second, purify it as it passes through system. And third, returns it to circulatory system. So what is lymph? So the lymph is fluid within lymphatic vessels. So that is called lymph. The lymph vessels around the small intestine assist with fat absorption. So it picks up absorbed fats, delivers to circulatory system. These lymph vessels are called lacteals. So the third one, lymphatic and immune system work together and forms a group of cells, tissues, organ and molecules. So the body primary defense against pathogens. So it includes foreign invaders and own cells that have become diseased. So these are anatomy and physiology of lymphatic system. Now let's see about lymphatic vessels. So it begins as very small lymph capillaries in tissues. So the capillaries merge into large, so that is called as lymph vessels. So finally drain into one of two large lymphatic ducts in thoracic cavity. So this is called lymphatic vessels. Now lymph nodes. So it is also called as lymph glands, but not real gland. So it composed of lymphatic tissues. It located along route of lymphatic vessels. Okay, let's see about lymphatic organs. The spleen located in left upper quadrant of abdomen. So it consists of lymphatic tissues that is highly infiltrated with blood vessels. So the vessels spread out into slow moving blood sinuses. So the next lymphoid organ is thymus gland. So it is located in upper portion of mediastinum. It secretes hormone thymosin. So it changes lymphocytes to T lymphocytes. So it active in unborn child and throughout childhood until adolescence, when it begins to shrink in size. And the another lymphoid organ, tonsil. So it collections of lymphatic tissues located on each side of throat. There are three sets of tonsils: palatine tonsil, pharyngeal tonsil, and lingual tonsils. Our body's ability to defend itself against pathogens, bacteria, virus, fungi, protozoans, toxins, cancerous tumors. So there are two forms: natural immunity, acquired immunity. So let's see about natural immunity. What is natural immunity? It is also called as innate immunity, not specific to a particular disease, does not require prior exposure to pathogens. So the example are macrophage. So the WBC that's ingest any pathogens encountered. The next one, acquired immunity. The body's response to a specific pathogen may be either passive acute immunity, active acute immunity. So the acquired immunity further divided. So the passive acquired immunity, active acquired immunity. So the passive acquired immunity result when a person receives protective substance produced by another human or animal. Example, maternal antibodies, antitoxin. And next, active acute immunity. So it develops following direct exposure to pathogen. It stimulates immune response. So the series of mechanisms designed to neutralize pathogen. Next, let's see about lymphatic and immune vocabulary. Allergen. The antigen causing an allergic reaction is called allergen. Allergist. The physician who specializes in testing for and treating allergies, so they are called allergist. And next one, allergy. The hypersensitivity to a common substance is called as allergy. Autoimmune disease. So the disease resulting from the immune system attacking its own body is if a pathogen. Examples include rheumatoid arthritis and systematic lupus erythematosus. Next, let's see about surgical procedures. Lymphadenectomy. So the surgical removal of a lymph node done to test for malignancy or metastasis. Next, medical procedures. Immunotherapy. A patient receives immunoglobulin injection or antibodies to treat a disease is called immunotherapy. And another one, vaccination. Exposure to weakened pathogen to stimulate immune response. Person will then be able to fight off pathogen if exposed to it in the future. It is called immunization. So this is the lymphatic system. So let I give the overview of the lymphatic system. So nothing. So the lymphatic system is a vital one-way network of vessels, nodes and organs. So it maintains fluid, absorbs dietary fats and supports immune defense by filtering pathogens from intestinal fluid. So this is called the lymphatic system route.